All right, so we're going to go through the lateral glide of the cervical spine. So the way that we're going to position the patient is where we don't have to do any work for supporting his head. So we just pull the pillow out from underneath him, and we have all this space to work with. So if you come around, and then I just want you to put your hands on his neck and just feel what I feel, right? So I'm gonna be like this. And usually I'll be like essentially gentle compression, and then ideally you're moving your hips and your hands are just sensing.
You can so that right leg, you're supporting the
Essentially you want to have this dissociation, right? So you can see his midline, right? And then that should stay the same. It's not a side bend of his neck, it's like a side glide.
Yeah.
And you want to continue to work yourself down the neck as you get that side glide. So how much pressure do you have to put to move it, and how does it spring back? So these segments feel pretty good.
Yeah.
In the upper cervical, it's more hyperlong. Right, and if we were going to do that combined joint assessment, be like this, a little bit slower. And right, that gives us a little bit more information. We can start to feel some of the tension down on that right side.
But in this, when you do the lateral, it's kind of like this is just stabilizing. This is stabilizing. And
Yeah.
this is
So if I was to do it myself, right,
Yeah.
and what would that look like? Yeah. So I'm like supporting his head there, and so he wants to be here, but I need him to be neutral like that.
Yeah, there you go.
Yeah, I guess you're right. I do just support this versus you could come down like this, but it doesn't give. I don't give it enough support. I have to like be there as a counterbalance. Is that okay, Mac?
Yeah.
All right. Versus like when and just relax your neck if you're okay. Yeah, so he's a little guarded, but that would be the movement. Be like this.
Okay, so for lateral glides, you're like here, and then this.
Yeah, so I'm using my proximal phalanx
Right.
on the articular pillar on the right side,
Yeah.
and I'm gently gliding. Like again, I would have this elbow out because that's the vector of force,
Yeah.
or the vector that I'm using to assess.
And so then just this hand is going down the
Yeah,
cervical
but
spine.
there's still crosstalk between the hands. This one's going down, but I'm supporting and moving with that opposite hand.
Oh, like supporting the cervical. Okay. Okay. It still kind of feels not right.
It doesn't look right.
Yeah.
Right, so if you come around the side, right, so if I was just to do just pure side glides without having the hand supported there, right, essentially I'd be like this. And if I wanted to be, so he's a little bit far down from the table, right, and you can kind of feel that because they're watching you. Mac, do you mind just scooching up the table? Yes. Yep, keep coming. Now I'm right over him. I can get down to my squat stance, right? And I can actually just move my hips.
Okay.
And I am offset with my hands. One's down, one's up. But you can be, like the other way that you could do it is using like paddles. Right, where I'm like, I'm straddling the neck. Like, what does that feel like? What does this feel like?
Okay.
Maybe that's an easier way for
Yeah, I'm gonna try that. Okay. Right here. But still, like, mostly from this hand.
It's like
Or
it's
this
yeah,
one
it's,
is more
it's most almost like pinball, right? So I'm going back and forth with
like
the
this.
yeah.
Okay.
So you don't have to. I don't want you to. So push your push down. And so like
How does this feel?
hard, like you're gonna crush.
It's good. I just get ticklish.
Uh-oh.
That's why I'm trying hard not to laugh. I get really ticklish, right here, especially from like.
Sorry.
No, you're good. But when Mike did it, I was trying to not laugh. I was trying my hardest, but I was tensing up. But it's good. It's like,
Compared to Michael,
I think
is this
Mike was more in depth, like deeper.
deeper.
Yeah.
Like, yeah, I mean, I was moving his torso when I was doing it, right?
I'm sorry,
Yeah.
Mike. I was ticklish.
That's fine.
forgot to
I
inform
could
you
tell
guys.
you. I could tell.
Like,
That's fine.
still.
Yeah, it was clear that you weren't able to really relax.
Yeah,
I couldn't tell
I
what
get ticklish.
was going on. Yeah.
I think I like the paddles better.
You look more comfortable with the paddles.
Yeah.
Yeah.
Yeah. Okay, but like a little more. I feel like the joint played more. Like
Great.
this. Okay.
Again, it doesn't matter how you get the information as long as you're consistent
Right.
and that you're getting accurate information.
Yeah. Yeah. Okay. Thank you so much for.
Awkward.
Yeah. Wait. Side bend extension.
So you got too much of a lift of his neck,
Okay.
right? So
we're gonna relax.
yeah, first just side bend.
Then let's
Side bend.
No, side bend is
Without the-
so he would be side bend to the right. So it's if you're assessing the right side, it's an ipsilateral side bend.
Okay. So I'm gonna go. I'm just gonna. Here we go.
there you go. So then you're right now. I'm
Side bend.
That's a rotation.
So yeah.
Side.
Yes.
Spine's like straight. So
Extension rotation. Wait. So side.
or neck actually.
Side bend.
Yep.
Extension.
Crush the end.
Rotation.
Yeah. So your extension is like a PA.
Oh. Okay. So.
Side bend, extension, rotation. If I can't, let me
Yeah.
get through your hand. So it's side bend, extension, rotation. Side bend, extension, rotation. Side bend, extension, rotation. Side bend.
Okay. It's kind of like biking.
It's like rotation, right? In a sense.
Yeah.
Yeah.
Yeah, that's what
Right?
it feels
And
like.
then,
I
like,
mean,
for me, it's like, I'm like
You're
yeah,
moonwalk.
kind of weird. But
Okay, but it kind of feels like I'm just moving your skin right now. So sorry. Okay, so
Very good.
more like this,
Yep, but then so this portion of your finger
more
needs
in.
to be on his articular pillar.
Okay.
And right now it's like way out the heck in space. Yeah. So you got the motion, but
Okay.
you ain't getting the information.
Okay. Right. With compression, like some.
If you need it to get to the joint. But again,
Okay.
like this needs to be like there.
Like this,
you got
right?
it more.
This? Okay.
Because then you're gonna come to midline, you're gonna take the soft tissue up laterally. Does that make sense?
Yeah. Okay. Wait. This does feel better. Wait. I need to go more in. Okay. Yeah. Okay. Biking. I
Nice.
can't forget it. Okay. Thank you.